Perfect. Well, thank you, Ms. Leah and Ms. Imani, for organizing this. This is such an important topic, I feel, and a lot of women are just not aware about it. And thank you for giving me this platform to kind of create more awareness regarding it. All right, let's get started. So pelvic floor therapy, my domain is pregnancy, postpartum, and beyond. So a little about me. My name is Shikha Shah. For people who cannot pronounce it, the easiest way to remember is Chicago minus the go. All right, I have a doctorate in physical therapy, and I have been practicing in the state of New York for 12 years. My major focus has been orthopedic population, but last 4 years, I kind of diverted more towards women's health. A little about my story, what kind of made me dive into women's health. So everyone I think knows who is Ishan, but he is my son who is with Kiddy Academy since 2021. I delivered him in 2020, and I myself kind of faced a lot of postpartum challenges. Varying from postpartum depression, I ended up having a 5-finger separation, diastasis recti, by probably doing the wrong exercises that somebody should have guided me to not to do. And there was just not much guidance out there regarding this whole thing, and diastasis is just one of the condition. I heard so many women talk about bladder leak or bowel leak, which is called incontinence, prolapse, where all the organs kind of fall out of your vagina. And this kind of bothered me a lot, that when you go to your 6-week follow-up appointment with your OBs, it's only for like 5 minutes. And none of these questions are answered, or even if you are not aware about it, they don't even speak about those problems. You mentioned back pain. Yeah, it will go down in few months. You mentioned lower abdominal pain. It will go down in few months. But nobody kind of guides you to kind of go and see a pelvic floor PT, because these conditions can be resolved. So that's what kind of made me get my certification in prenatal postpartum exercise specialist. And yeah, that's where my journey began towards women's health. And I have been treating these conditions for almost 4 years in an outpatient setting. But what I found was this requires one-on-one attention. It needs that one-on-one care with women to kind of point out the different areas, missing pieces, and kind of joining together to kind of solve the pelvic floor dysfunction. So let's get started. So what is your pelvic floor? It is basically a part of your core system. So the easiest way that I can demonstrate this is a balloon. So imagine this is right here. This is your diaphragm, which is the top of your abdominal cavity. This is your pelvic floor, which is the bottom of your abdominal cavity. You have your abdominals in the front, and you have your back muscles in the back. So this is pretty much what your pelvic floor is. Now, your pelvic floor acts as a support to your core muscles as well as your internal organs. You have your bladder, you have your rectum, you have your urethra, you have your uterus. All these organs are supported by your pelvic floor. It stabilizes your pelvis when you are kind of carrying out different functions in your daily activities. For example, bending, lifting, twisting, walking, all these activities need your pelvic floor muscles to support your pelvis so that you don't end up with any pain or dysfunction. Now, what is the normal relationship of your breathing pattern with your core and your pelvic floor? So with your resting inhale, your diaphragm, and this is your pelvic floor. With your resting inhale, they go down. With your exhale, they move up together. I repeat that again. It goes down with your inhale and goes up with your exhale. This is your resting inhale. This is what we pretty much kind of spoke about. You have your diaphragm at the top of your abdominal cavity. You have your pelvic floor at the bottom. You have your transverse abdominis, which is your deep core muscle in the front. And then you have your back stabilizers, multifidi being the main muscle of your back. So now let's talk about intra-abdominal pressure. This is pretty much the steady pressure that is developed in the abdominal cavity, and it occurs with any kind of, connection between your abdominal wall and the visceral function. Now, the normal pressure in the abdominal cavity has to be less than 5 millimeters. But what happens is when an external force is added, that's when your pressure tends to change. It can rise, it can decrease depending on what activity you are doing, but 90% of the time it rises. For example, you are bending forward to pick up something from the floor. So that is an external force that you are creating, which requires your core system, which requires your abdominal pressure to be maintained, contained in that abdominal cavity that we spoke about. Now, during pregnancy and postpartum, because of the postural changes, because of hormonal changes, the pressure in the abdominal cavity, it tends to change with certain activities. For example, you're pregnant, as the pregnancy prolongs, as it kind of moves on, your posture changes a lot. Your center of gravity kind of moves forward, so you have to adjust your body accordingly. So if you see, most of the clients will be rounded shoulders with a huge abdomen in the front, your back arched. So that's the basic posture that you have during pregnancy. Now, because of that, because the center of line of gravity has changed, that kind of creates a lot of load down on the pelvic floor. Some people can have dysfunction and pain. Some people can be symptom-free. But that doesn't mean that your pelvic floor is not weakened because of these problems, because of these normal changes that happen during pregnancy. So it's a good idea to kind of go through a pelvic floor consult in the beginning of your pregnancy itself, so that you can start preparing your pelvic floor muscles for labor, for a healthy birth. So that's pretty much, we spoke about any change in the pressure during pregnancy, postpartum can increase the load on your pelvic floor, leading to complications. Some of the complications include back pain, lower abdominal pain, hip pain, sciatica, piriformis syndrome, diastasis, which is basically abdominal separation. Incontinence, it can be urinary incontinence, bowel incontinence, vaginismus, which is basically pain with sex. So pregnancy changes and impact on pelvic floor muscles. We already spoke about the postural changes that take place. We spoke about the center of gravity, which shifts anteriorly, and then your whole body has to accustom to those changes. Increase in relaxin hormone, which causes joint laxity, which can affect your symptoms, which can cause pain, which can cause dysfunction, which can also lead to tightness. Now, all this can contribute to muscular imbalances, again, leading to pain and dysfunction. Now, the most common pelvic floor conditions seen during pregnancy are pubic symphysis pain. So basically, this is the pelvis. This is your front. This is your pubic bone. This is where most people end up having pain because of the pressure, because of the weight of the baby, because of the postural changes. That being said, this can be taken care of if seen early during the pregnancy stages. You have round ligament pain, again, because of the weight of the baby. You tend to have that lower abdominal pain throughout, while walking, while sitting, while laying down. That's your round ligament pain. We can definitely fix that using different kinds of techniques like taping to kind of support your abdomen up and in a high state to avoid that loading down on your pelvic floor. Back pain, hip pain, again, the same, because your core gets weak. Pelvic floor is a part of your core. Your pelvic floor also gets weak. That tends to end up as back pain or hip pain. You can have buttock pain, which we spoke about, your sciatica, your piriformis syndrome, that all is a part of your buttock pain. You can also have tailbone pain, which is basically the tip of your sacrum. So when you sit for too long, or when you're trying to change positions on the bed, that's when you kind of tend to have that pain, if at all you develop that pain. And that is also a part of a pelvic floor dysfunction. Heaviness in the pubic region, sometimes people say that it's because of the growing baby. To be honest, it's not the weight of the baby. Baby has nothing to do with the heaviness in your pelvic area. It's your pelvic floor muscle weakness which causes those problems. What are some postpartum changes and impact on pelvic floor muscles? So Postpartum, you have a lot of activities to do. You're feeding your baby, nursing, you're lifting, you're bending over, you're carrying your baby 100 times a day. And all this adds tension on to your intra-abdominal cavity. You already have a weak core because of your delivery. You don't have that lower abdominal support. You don't have a good support from your pelvic floor, which is what kind of gives away into back pain or diastasis recti or bladder or bowel leakage, because your whole, the abdominal cavity is not stabilized post-pregnancy. The early on in post-pregnancy you get into therapy, the better and faster the recovery is. That being said, I do have a lot of clients who come in 5 years postpartum with back pain, and nobody has mentioned to them ever about pelvic floor therapy, but they do get better. I mean, I currently have a client who saw me 8 years postpartum with back pain and just 4 sessions of therapy, and she is doing a lot better. So postpartum doesn't necessarily mean that it has to be an immediate thing post-delivery. Postpartum can last lifelong if not taken care of. So just make sure you get your pelvic floor consult done. Just make sure you get it checked so that you're not missing any parts, and no pain is normal during pregnancy or postpartum. We tend to kind of create it or kind of show it as a normal symptom, but no dysfunctions or no pain is normal during pregnancy or postpartum. So let's make that effort to change. Let's pass this information to other women so that, we ourselves can build a community, and create that awareness that pain is not at all common during pregnancy or postpartum. 90% of the women during third trimester develop lower abdominal separation. Again, this is because of the abdominal pressure changes in the abdominal cavity that we spoke about a few slides back. That being said, few women post-delivery, it fixes by itself, it's not that major. It again depends on a lot of factors, the weight of the baby during delivery, any other symptoms that you have had during delivery, like for example, if you have a large tear in your perineal muscles, or if you already ended up having back pain when you were in your labor position. All those things kind of play an important role, whether or not your diastasis might get worse post-pregnancy. But again, it's a good thing to kind of check it out. If it's very common, if you go on YouTube and if you check how to check your diastasis, they give you clear videos on how to kind of check it. And I highly recommend every woman should do it right after birth, because it's very important for that lower abdominal muscle strength to be checked, because all your activities, when I say all, literally all, bending, twisting, moving, sleeping, changing positions, it depends on the strength of that lower abdominal muscle, which is connected to your pelvic floor. People who have had C-sections, scar management is so important. I cannot stress enough the importance of massaging your scar, because if you don't do that well ahead of time, what's going to happen is you're going to start developing adhesions between the skin and the muscle. Sometimes it also goes down to the organs, limiting your movement, which can lead to pain and dysfunction. So if you have a C-section, if you have multiple pregnancies with C-section, the chances of diastasis increases, the chances of adhesion formation increases, and the chances of dysfunction increases. So please get your scar massaged. It doesn't matter if you do it right away or 5 years down the line, because you need to break those scar tissue. You need to break those adhesions in order for you to feel your pelvic floor, to activate your pelvic floor. When I talk about feeling your pelvic floor and activating, we'll come down to that point when we go to the treatment section.
That's super helpful information. I know Imani and I both perked up because we both had multiple C-sections. So that's something no one said to me. The only time I ever heard about pelvic floor and diastasis recti, it was I did a gym class, and I will say the lady who ran it was don't do sit up. She was very on top of it. But if I hadn't heard from her, I would have probably been doing sit-ups and that's
pretty much what happened with me as well, because I really like exercising. I wanted to get back to Pilates and yoga, and I started doing like sit-ups, crunches, roll-ups, which is highly against diastasis. Not that you can't get back to these things in the later stages, but in the initial part, you have to stay away from it to prevent any worsening of your conditions or any worsening of your tear. So I totally get what you're talking about, Ms. Leah. Not everyone is aware about these things. And the more we talk about it, I think the more webinars, the more seminars we create, I think more women will be interested in learning about it and knowing that there is help out there. All you need to do is just step up and seek for help. So good point. Thank you for bringing that up. All right. So next important thing is gut health. So I don't know if you guys have faced like constipation, bloating, changes in bowel movement during pregnancy and postpartum, more so towards postpartum. I myself I was constipated like a lot postpartum in the first year. Again, I had a C-section that had to do with my skin adherence to the abdomen, to the intestine, which kind of limited the mobility in that area, which led to constipation. Obviously, your diet, your nutrition also plays an important role in that, but this is just the physical side of it that I'm talking about. So if you are facing like severe constipation, bloating, pain in the lower abdominal area, it could be related to C-section. So it wouldn't harm to kind of get it checked out. Now, the common postpartum conditions that I have dealt with personally, diastasis recti, which is basically lower abdominal separation, back pain, again, because of the intra-abdominal changes, the pressure is not contained in the cavity, you end up with postural changes causing that back pain because of excessive muscle tightening. You have your hip pain, you have prolapse. Prolapse is basically where the organs, they just kind of drop out of your vagina. There are different degrees and different grades of prolapse, but if not treated, it can get worse, and then you'll end up having a surgery for it. But that's the reason. Get it treated, get to a pelvic floor therapist as soon as possible, to kind of avoid these complications later. Vaginismus, we spoke about it. It's pain during sex. Now, this can be during pregnancy, postpartum more. It has a lot of factors associated with it. Let's talk about the mental piece first. So you have been through a trauma, basically. Your body has been through a trauma where you are kind of delivering the baby. I mean, it's a good feeling, but still your body needs to recover from that. And sometimes women just are not able to recover from that mental aspect of that trauma, which actually causes tightening of the pelvic floor muscles. And the more tightened the pelvic floor muscles are, the harder it's going to have, the harder time you're going to have having a proper bedroom time or a proper intimacy with your partner. But again, this is treatable. We can kind of work on it. We can show you how to relax your pelvic floor. There are different types of dilators available out there. You just start with the smallest version of it, and we teach you, we prep you kind of how to let your pelvic floor muscles relax. And it's not just during sex. Like if you have pain with your pap smear, if you have pain with any OB test, that means that you have that pelvic floor tightness, which needs to be addressed. You can have any kind of perineal pain post-normal vaginal delivery as well. So just like C-section massage is important, perineal massage is equally important, because if you don't do that, you're going to end up with pelvic floor tightness. Core weakness, like I mentioned, everything is related. Your transverse abdominis, which is your deep abdominal muscle. So it kind of wraps around. That's your transverse abdominis. That is the muscle which gets affected during pregnancy and postpartum. And probably you might have weakness before even you got pregnant. So it's important to work on this transverse muscle a lot. Most of the times it's more of an activation issue versus any weakness. So your brain just forgets how to kind of activate that muscle because of the load on the body, because of the baby's weight. And a lot of time it's just kind of preparing your brain, to kind of relearn the technique to how to engage your lower abdominals while doing the exercises. But once you kind of get it, it's just going to be a normal thing. You will have no difficulty doing your lifting, bending without, engaging your transverse abdominis. But that mind to body connection is very important to activate that lower abdominals. Some people end up with rib flare-ups because that's how the baby grows here. Your ribs kind of expand, and some people can get back into the position. Some people just stay stuck in that position post-delivery. So that kind of impacts your pelvic floor a lot. Any questions so far? Okay. All right, so one of the most important questions that I get asked a lot is regarding Kegels. Does anyone know what Kegel is? Come on, Miss Imani.
I do. I just don't know how to explain it.
Okay.
The thing, this is that thing that helps you to exercise your muscles, right?
I'm sorry, what's that?
I can say it at work. I'm sorry.
It's like
That's
an
okay.
exercise to help like your vaginal muscles.
Correct.
Exactly,
It's your pelvic
Mr.
floor muscle. It's your pelvic floor muscle exercise. That's right. But do you need to do them? How many of you were told during pregnancy, do Kegels?
Yes,
and
I
you
was definitely told to do them.
Yes, and you probably ended up worsening your symptoms doing more Kegels because what you are needed to do is reverse Kegels, which is a new concept. It is lengthening of your pelvic floor muscle. The basic funda behind that is if you don't know how to relax a muscle completely, you cannot effectively contract a muscle. That's the muscle length tension relationship we are talking about. So imagine the muscle is already contracted, you don't know how to relax, and you keep on doing Kegels again and again, making it worse, tightening it more, causing weakness because you are just kind of contracting, not letting it relax, not letting it effectively, contract to the fullest position. So that's what many of my clients come for me is by doing a lot of Kegels during pregnancy because it was recommended by their OB to do Kegels, or for example, some other physical therapists who do not specialize in pelvic floor. So how many Kegels are required? Well, the answer is 0. You don't need to do Kegels at all to maintain a healthy core life. What you need to do is reverse Kegel and then learn how to contract the muscle correctly, which is naturally going to happen with your breathing pattern. But to learn the reverse Kegel is a challenge because it involves a lot of mind-body connection. If you don't know where your pelvic floor is, if you don't know how to connect to your pelvic floor, you will not be able to lengthen the pelvic floor in order to get an effective Kegel. All right, so what is pelvic floor therapy? Well, I put it as a holistic approach to your physical and mental health well-being. A lot of emotional problems, a lot of stress-related situations, a lot of complications postpartum arise because of your pelvic floor. The fascia is connected. Your pelvic floor is connected to visceral organs. Your pelvic floor is connected to the fascia as well, which has an impact on your mental and your physical life. So that's the way I put it. It's a holistic approach to treatment. Before you go in for surgery, before you go in for any kind of, other treatment route, make sure you kind of check out this holistic approach, make sure you give some time to this and then go into the surgery. Because even if you do surgery, you will end up with physical therapy. Then why not do physical therapy before that? It requires a lot of mind-body connection to make you aware about your body, your symptoms, the dysfunctions, and then treat it with a customized program based on your needs. Like, for example, if someone has a diastasis recti, the program is going to be slightly different, focusing more on core activation, still focusing on relaxing your pelvic floor because that part kind of goes together. Versus a patient who has like stress urinary incontinence, which is basically leaking whilst coughing or sneezing. So if you have that, that is going to be, more about pelvic floor lengthening and then correctly teaching how to strengthen your pelvic floor muscle, which is where the Kegels come into play. All right, what to expect during the first session of pelvic floor therapy. So what we do basically is a detailed assessment of the entire body. It starts with your breathing, because if you are not doing a deep diaphragmatic breathing, that has an impact on the accessory muscles of your breathing. You are basically overusing those muscles, which can end up with pain and dysfunction. So a lot of times you see postpartum neck pain, mid-back pain, lower abdominal pain, because of nursing positions, because of lifting, because of feeding, because of, all the 100 activities that you have, placing the baby in the crib, taking him out. So a lot of it has to do with your breathing. If you are not using the correct breathing technique, you're going to end up with a shallow breathing pattern, which is basically called a paradoxical breathing pattern, where you kind of use your shoulders a lot, where you kind of use your chest a lot, whereas the breath has to come through your belly. It is your belly breathing that we need to focus on. Now, when I say belly breathing, it's your abdomen kind of expands, and then on your exhale, it comes back to the neutral position. But at the same time, your ribs have to expand and come back to the neutral position. Your abdomen expands, comes back to the neutral position. Your pelvic floor expands and comes back to the neutral position. So this is the whole breath work that we are talking about. It starts with your ribs, it starts with your core, and it starts with your pelvic floor. If all these three things are not working together, you are probably using your accessory muscles. And that is the reason most of the people end up with neck pain, back pain, hip pain, any sort of pain, any joint pain, leaks, because you start bearing down on your pelvic floor. So breathing is the first important key to rehabilitation. Next is your posture. Again, when we kind of assess your breathing, we also check your posture. Most of the times, rounded shoulders, neck forward. This is how I see most of my moms. And it has an impact on your core and your pelvic floor. Everything is related. Your fascia is related. And that's the reason we check your posture as well. Rib movement, like I spoke about, is it flared? Is one side flared? Is it like depressed? If it's depressed, is it kind of expanding properly during your inhale? So all these things kind of matter a lot when we do the assessment. The next important step is core activation. Again, like I spoke before, your transverse abdominal, which is your deep core muscle, needs to be activated right after birth. That is the muscle which is compromised the most, causing problems to your pelvic floor. So you need to learn how to reactivate that muscle and then get into your core strengthening program. Next is your pelvic floor assessment, external as well as internal. It depends totally on the client's needs. And if the client is comfortable doing an internal assessment, we never force it on any of the clients, because externally we can still fix most of the issues. But if you want like a total fix, like where the last 20% is missing, then we might have to go internally to kind of, release some of your pelvic floor muscles. But again, the assessment and the examination is never painful. We kind of consider all the measures. If it's painful, you always let us know and we back off a little, because the pressure kind of varies from therapist to therapist. So just keep an open communication and just let your therapist know if it's hurting you. Again, nothing should be painful. That's the mantra. Nothing should be painful, not examination, not exercises, nothing. So the open communication is the key here. If anything hurts, you report to your therapist right away. And the last piece is movement analysis, where we kind of get you going through a different series of functional movement patterns, bending, twisting, grabbing something from the floor. Basically replicate your postpartum activities and see which piece is a problem. Is your pelvis moving correctly with all those movements? Is your ab activating with those movements? How is your posture? How are your shoulders? How are your back muscles? Are they crunching too much? How is your pelvic floor? Is it kind of not relaxing at all? So all those things are very important to be checked during a functional movement as well, because the first 4 things can be fine. And still you might have pain, but that is only when you do a functional movement. And that's why this part is very important, to kind of carry you through that function, carry you through that motion, which is painful, so that we can correct it depending on what all pieces are missing. And then we kind of together come up with a plan, depending on the symptoms, depending on the condition, depending upon your diagnosis. Like I mentioned, for a diastasis, the plan is going to be different. For a bowel or a bladder leakage, the plan is going to be different. Or somebody might just show up for a core stability program that might need a different plan. But what I mean to say this is the whole basic pattern that we follow during a pelvic floor examination. When we talk about pelvic floor, it's not the vaginal muscles only. It's your whole body, which plays an important role to maintain that pressure in the cavity and not bear down on your pelvic floor. Any questions on this? All right. So what is the treatment of pelvic floor dysfunction? Like I said, the eval incorporates the whole body. The treatment necessitates the incorporation of the whole body as well. It starts with deep breathing exercises. Again, like I discussed before, how your ribs are moving, to kind of teach you to expand your ribs in 3 directions, 360-degree pattern of movement. That's what we call it. Your belly breathing, is it too much? Is it too less? Or not at all? So we kind of fix that. Your pelvic floor expansion, are you able to expand it? If not, what is the reason? Is it tight? Is it weak? Is it that you are not just able to connect to your pelvic floor? That's where the deep breathing comes into action. This piece is so important. I can't even begin to explain. Like, I have clients who are not able to connect to their pelvic floor for the first 4 sessions. I give external feedback, internal feedback, and still it doesn't work for them. And the reason I'm talking about this is because it is so important to understand where the pelvic floor is, to kind of gauge in your mind where it is, to feel for the breath going down to the pelvic floor. Because if you're not able to make that connection, you're not able to relax your pelvic floor. If you're not able to relax your pelvic floor, you're not able to contract it. If you're not able to contract it, you're putting the other systems on a compromise. So breathing is the first basic step of rehabilitation. And then once you kind of make that connection with the pelvic floor, then we dive into your core engagement. Then we dive into core series, which incorporates your strengthening, your stabilization, functional movement stabilization. We kind of push you towards lunges and squats and basic, all the goals that you want to get back to. Some people want to return to yoga. Some people want to return to weightlifting or running. So we kind of customize the plan accordingly. So I just wanted to kind of discuss a case study here, just to kind of, for you to kind of understand the importance of pelvic floor therapy and kind of therapy for the whole body versus just the vaginal area. So I had a client, this is just 2 weeks back, and she came in, I believe it was 8 weeks postpartum. 8 weeks postpartum. She had a C-section. The initial part, we worked on C-section release, C-section scar management, and then came the part where she had to make that connection to the pelvic floor. 2 whole sessions, we worked on different strategies to work on the pelvic floor connection. And still, she always felt that there was like a rock, in there, and she's not able to feel that breath going down. So the analogy I use while explaining how to feel the breath to your pelvic floor is like a flower blossoming. So you inhale, your ribs expand, your belly expands, and your pelvic floor expands. So it's like a flower blossoming and flower closing. So she was not able to feel past the abdominal expansion. She always felt a rock, hitting a rock before going down to the pelvic floor. I checked the pelvic floor tension internally, it was fine. Externally, it was fine. I checked if the lower ab, if there was any adhesion left in the C-section area that could be contributing to that. It was totally fine. And I don't know, something just occurred, and I checked her mouth while doing those exercises, and she was clenching her teeth. That clenching the teeth caused that stress in the TMJ, Like I said, the fascia is connected. Your TMJ is your mouth joint, your temporomandibular joint, which helps you open your mouth and close. And she had tension in that TMJ, which was causing that tension in pelvic floor, which was not allowing her to feel for that breath going down to the pelvic floor. What I focused next was on releasing the TMJ, doing some meditation strategies, allowing her to relax her upper trapezius, which is the neck muscle. And I gave her a home exercise program for 3 days. The 4th day, she texted me that she's able to feel down to the pelvic floor. So the whole point of this is, it is not just the bottom area. You need to kind of see the whole body when you are treating your pelvic floor, because a lot of people just come with that, set mind that, no, you're just going to do internal work in the pelvic floor here and there. No, it is not just about that. If you are not able to make that connection, we have to kind of go through the whole body. Some people might, wonder, like, what has TMJ what is TMJ doing in pelvic floor therapy, or how is it even related? But the fascia, there is research which has shown that fascia fibers are connected all over the body. They support your organs. They support all the joints. And if your TMJ is tight, your pelvic floor is 90% tight as well. So hopefully this kind of expands your knowledge about pelvic floor therapy and how it's not just related to your pelvic floor muscles. Everything has to be worked on in order to relax your pelvic floor, in order to engage your pelvic floor. All right, are you guys ready to do an exercise? Okay, so let me just put this out there. Inhale deep through your nose. You're going to exhale like you are blowing a balloon 3 times. So when you're inhaling, you're focusing on your rib expansion, you're focusing on belly breathing, you're focusing on that flower blossoming, your pelvic floor expanding. With your exhale, you are focusing on everything closing out. Now, while doing this, you can imagine how much mind-body connection you need to feel down to your pelvic floor. Anybody felt it through the pelvic floor?
I don't think so.
Yeah. So, Ms. Imani, your pelvic floor is tight. All right, so that's my point. Like, you need.
What's going on?
Yeah, so that's my point. Like, you require a lot of mind-body connection to feel for that pelvic floor, and then kind of continuously work on it. Like, breathing is so important, and breathing correctly is even more important. A lot of people just do. You're just going to end up with more problems. It has to be a deep inhale, exhale. Now, many times people ask me, like, do I have to breathe like this throughout, like postpartum? No, it is just retraining your brain in the beginning to how to breathe. And then naturally, it just comes along, but that first part is important. That retraining part is important. That relearning part is important. All right. And happy Women's Day to all of you. And this is my 5 mantras for happy life. Meditation, 5 minutes a day. Physical activity, at least 30 minutes. You can do walking, you can do strength training, you can do a combination of things. Prioritize self-care. I cannot stress, this is so important. Whatever you love, just do that for even 2 minutes in a day if possible. I love dancing. I dance with Ishan all the time. So yeah, just prioritize what you love. Communicate your feelings to your partner, because this is so very important emotionally and physically. I never seek for validation, which has helped me a lot. So I put it out there. Never seek for validation or appreciation for what you're doing. And just say every day you are doing your best for you and your family. This is what keeps me moving, and I hope it will keep you guys moving as well. All right, any questions?
I have a question.
Yes.
Do you see that carrying like extra weight in your abdomen, does that have an effect on your pelvic floor?
It does. Now, to answer that question correctly, it depends on what is that extra weight coming from. Do you have diastasis, which could be that extra weight adding? Do you have any gut issues, constipation, which could be that bloating, that extra weight again? So assessment is required, but to answer your question, yes, it does have an effect on your pelvic floor. It does cause that bearing down effect on the pelvic floor. Yes.
Hi. The pelvic floor being, affected, can that cause incontinence as well? Or that's related to the different thing?
Yes. So your pelvic floor muscles, so this is your anal opening and this is your vaginal opening. These are your pelvic floor muscles, and this is your urethra, which is where you pee from, right? So the pelvic floor surrounds all these areas. Now, tightness in the pelvic floor can push pressure on the urethra, which kind of causes problems with your bowel and your bladder, So there are different kinds of incontinence. Now, leak, it could be from, sneezing, coughing, which is like external pressure created on it, and then you leak. That is basically weakness of your pelvic floor muscle. It could be more of an urgency issue or a frequency problem where you end up going, 12 times a day. The normal frequency is 5 to 7. So if you do that, then, and you are not able to hold the urine, that's a different thing. So that is more of a relaxation problem. It's called urge incontinence. But to answer your question, yes, your bladder, your bowel, they are protected by your pelvic floor, and any tightness in your pelvic floor can cause those issues.
I feel like this should be more informed, because in my personal case, I struggled with it at the beginning and I didn't know maybe if I could avoid it with some pelvic floor exercises.
Yes.
And I was overweight. I was obese also, so that didn't help with,
Yeah, so when you talk
that
about
didn't help either.
obesity,
Yeah.
again, that's your core muscle. That's,
Yeah.
because your core muscle is weak from obesity. So you don't have that transverse abdominis, your
Plus
deep
pregnancy.
core. Yeah, exactly. And that kind of creates that bearing down on the pelvic floor that we were talking about, which kind of ends up with your bowel incontinence. And yes, you are right. You will face these issues more in early postpartum phase because you're just recovering from that part. Everything is weak. Your posture is not in a correct position. And then some people, they tend to recover after a year and they don't have these symptoms, but some of them do. And they just kind of make it a normal pattern. And like, this is how I have to live the rest of my life. But that is not true. There is treatment out there and we can fix it, no matter if you are 5 weeks out, 6 weeks out, 10 years out, 15 years out, we can still fix your problems. Because if you don't fix it right now, when you hit your menopause, it's going to get worse. Because your hormones come into picture, so many different things come into picture at that point. You will probably end up having more pain than usual. You won't be able to move around like you used to in your 30s, 40s. And all this can be prevented by taking pelvic floor therapy well in advance, before you even during menopause, it's recommended a lot, to do pelvic floor therapy because you go through like a hell of a mental changes, and pelvic floor therapy helps you with that. It helps you learn how to relax your pelvic floor muscles. It helps you learn how to activate your core. And all this is important during menopause as well. Any other questions?
I have a question. So I know this is all postpartum. Is there anything like exercise can prevent this, or even prevent the whole thing? I mean, of course, your pelvic floor is gonna shock after the postpartum. So any like a breathing exercise you can do to help you to recover better after the procedure or
yeah. So honestly, pelvic floor therapy should start during pregnancy. So when you are pregnant and you, like I said, some people might have pain, some people might not, but no matter what, your pelvic floor is weakened because of the changes. So if you kind of take a step forward and kind of go and get a consult from a pelvic floor therapist and start working on your breathing patterns, because that's basically what is considered a labor preparation course. That's where we kind of guide all the women. Most of the women I see during pregnancies, during third trimester, because that is the time when they actually feel more back pain and lower abdominal pain and round ligament pain. And then, it kind of becomes a little difficult to treat in third trimester. That being said, it doesn't mean that I can't help you at all with your pain. Your pain will get less with, breathing exercises and the different labor positions that we teach you, and to breathe, how to breathe correctly. Because sometimes if you see most of the yoga and Pilates classes, they teach you to breathe just through the belly. Nobody mentions about the pelvic floor, how the breath has to go down the pelvic floor. And for your labor, for your delivery, you need that pelvic floor to expand. You need that pelvic outlet to open for that baby to come out. And nobody teaches you how to expand that. So that is the difference. If you do that during pregnancy, your postpartum recovery is faster. Yeah, so there is a lot of breathing technique available during pregnancy and early postpartum. Now, if you have a C-section, the common frame time that your OBs tell you is after 6 weeks to get back to your activities. But that being said, the first 6 weeks, what we work on is correcting your breathing, making that connection to your pelvic floor. Because remember, it takes time to connect to your pelvic floor. It takes probably a month to connect to your pelvic floor. Once you make that connection, we can start working on your core. But at the same time, your posture, what about that? We need to kind of work on your postural exercises in that phase to help you kind of recover faster. So a lot of times I've been asked like when to start postpartum, pelvic therapy. My answer to them is as soon as you're comfortable with your little one, even if you can't come in, do virtual sessions everywhere. I think pelvic floor therapy does a virtual consult now. So just get on a call. It doesn't necessarily have to mean that you have to do twice a week, or 3 times a week. Once a week is sufficient to get that connection. You just need to understand how to kind of make it work. Once you kind of do that, it's okay. You'll be fine. If you promise me, you commit to me that you'll be doing 10 minutes of breathing every day, the way I teach you, you'll be fine. So the only point is that women don't go out to seek a physical therapist or a pelvic floor therapist. And it's not their fault because they are not guided in the right direction. I have not seen any person, come up to me so far in my career saying that my doctor prescribed pelvic floor therapy. And I'm not kidding, not a single person. All the patients that come to me, they kind of do their own research and they kind of advocate for themselves that let me try pelvic floor. And that is what I'm looking for. You have to advocate for yourself because healthcare is not going to change. Nobody is going to kind of, advise you different things out of the normal protocol. So do your research, get into pelvic floor therapy as soon as possible and, prevent all these symptoms. Prevention is always better than cure.
I have a quick question. I know you said if you've had a C-section, there's a certain massage. Now, is there a point where like you're past your C-section, like a certain amount of years that it's kind of pointless at that time, or is it still something that you should have?
Now, it depends on if you're talking about the visibility of the scar, there's not much we can do about it because the visibility has to be kind of, prepped up immediately after birth. Right. But adhesions, yes, we can still take care of it. In fact, if you don't do it now, you will probably end up with more symptoms because when they get adhered to the organs, the fascia surrounding the organs, that's a lot of problems that causes constipation, that causes your gut issues, that causes different kinds of problems. So that adherence, that's what we need to break, and it can be done at any point. Like I said, 10 years, 15 years, doesn't matter. You just need to get it fixed. Okay. And a lot of time it will not present to you with gut pain or anything like that. Most of my postpartum clients who have C-section problems, they end up with back pain.
Okay.
Because they're not able to activate their lower abdominals. And if you don't activate your core, your back muscles are overacting, kind of helping you to walk and helping you to kind of stay against gravity throughout the day. They end up being tight. Tight muscles are not necessarily strong. They become weak. And that's when they end up with back pain. So symptoms show up in a different ways. That is the job of the pelvic floor therapist to kind of diagnose like what exactly it's coming from. But it could be related to your C-section or for that matter, even your perineal scars. Any other questions? All right, so this is my information here. I opened up my practice in January, Dr. Shikha, Shah Physical Therapy, and I'm located in Sleepy Hollow. This is my website, my Instagram page, and my phone number. And if you mention Kiddie Academy to me, and if you want to get a pelvic floor consult, you get 50% off. So just let me know if you want to get it and you want to kind of do a quick physical therapy pelvic floor consult. More than happy to help out.
Thank you so much. This was super helpful. I feel like I learned a lot. I feel like we have this recorded. I'd love to share it with others in our community. I'm even thinking of all the moms with the little babies here as well, and maybe they can catch it before anything gets like, 5 years down the road, like some of us. So
or 17.
So thank you.
Just like, I don't know the name of the teacher there, but just like she mentioned, that she had problems early on, and if somebody was there to guide her, she could have taken care of it, So yeah, that guidance is important.
Well, we appreciate your time today. Thank you so much. And if anyone has questions, definitely they should reach out to you. And thank you.
Yeah, thank you so much for giving me this opportunity. Thank you.
Thank you.
Thank you, Sen, for joining us.